Hello, my name is Dr. Jesse Chrastil. Welcome to the journey to improve your quality of life with a minimally invasive hip replacement surgery. Hopefully this video helps provide you some information involving what the surgery entails, some of the risks and benefits associated with it, as well as some of the outcomes and recovery aspect of your minimally invasive anterior hip replacement surgery. I appreciate you taking the time to watch this video and trusting me with your hip. So what is an anterior hip replacement surgery? So an anterior hip replacement surgery is a minimally invasive and, more importantly, muscle-sparing approach to a hip replacement surgery. So what I do is I make a small incision in the front part of your thigh. I go in between the muscles. I don't cut any muscles, so we're not waiting for muscles to heal afterwards. I go between the muscles that extend the leg, or your quad type muscles. I go in between those muscles and the muscles that bring the leg out to the side, or hip abductor muscles. I then smooth off the cup or the acetabulum, place a titanium cup into the pelvis. I go down, I look at the capsule directly, I open up the capsule, and I actually remove the arthritic top part of the femur bone with the head and the neck. Place a titanium stem down into the femur bone, and then I top the titanium stem with a ceramic ball. These are all ingrowth type components, meaning these actually are coated with something that the bone binds to, and eventually these become part of your skeleton. So what are some of the risks associated with anterior hip replacement surgery? The biggest risk I worry about is risk of infection. Now that risk is relatively low. That risk is about 0.4 to 0.8%, so right about 0.5%. But again, that's not quite zero. We do everything in our power to minimize those risks, both at the time of surgery and in the postoperative recovery period. Another risk would be risk of perioperative or postoperative fracture. Again, that risk is very low. If there is a fracture, we fix it at the time of surgery, but again, risk is not quite zero. The next, probably highest risk would be risk of blood clot. The risk of blood clot is about 1 to 2%. That risk is low. The best thing you can do to prevent blood clot is early ambulation, early mobilization to keep your blood pumping and legs moving. We also will do some risk stratifying and make sure that you're on the right type of anticoagulation for you and your risk profile. There's risk of dislocation or instability. Risk is very low with an anterior hip replacement because we don't cut any muscles or destabilize the hip. There's risk of leg length inequality. I actually utilize specialty instrumentation during my surgery to minimize that risk and make that risk very, very low. There's risk of need for reoperation or continued pain, but again, those risks are very, very low. What should you expect the day of surgery? So the day of surgery, you come in either to the hospital or the surgery center. You'll actually meet with me once again in the preoperative holding area. You'll meet with your anesthesiologist. Our nurse will take us back to the operating room. Once you're in the operating room, the anesthesiologist usually does a spinal anesthetic, meaning they'll give you a shot in the back. You're numb from the belly button south. And then they give you a medication that helps you take a snooze throughout the procedure. It's a much more gentle anesthetic rather than general anesthesia. It's kind of like colonoscopy medicine. So when you wake up, you feel pretty good, almost rested, rather than hungover for the next 3 days. Surgery itself takes about an hour. We have you up and walking the same day. About 50-60% of my patients actually go home the same day. The other 40-50% stay overnight one night and go home the next day. The day of surgery, you can put weight on it. You'll probably be using an assisted device because it's going to be sore, but you can actually put full weight on it if you'd like. Usually for the first maybe week, you're using some level of assisted device, then you're slowly weaning off of it. By about 4 weeks, you're as functional and independent as you are today. Now today you're not perfect. That's why you're here seeing me today. That's why we're talking about hip replacement surgery. But you're at least to where you can consider your current baseline. And then after that 4-week point, that's when you actually start to see improvement. That's when you actually start going up and down stairs a little bit more pain-free than you are today. That's when you're able to do a little bit more than you are today. And hip replacement surgery is definitely one of those surgeries that most of my patients, by the time they're in the recovery period, they're saying, I wish I would have done this a little bit sooner. So we will give you a link to this video, as well as we will give you an informational booklet about hip replacement surgery. Thank you very much for taking the time to watch this video, and thank you for trusting me with the care of your hip replacement surgery.